A very good evening. I believe you are doing well. This is just a quick one. I just encourage you that anytime you come across our post, our video, let's share it. As it stands now, per the latest release of the Ghana Health Service, almost about 3.9 million Ghanaians are living with chronic hepatitis B. So it means that more people are living with a disease that we do not know. So let's get them diagnosed. The earlier we diagnose them, we'll be able to prevent liver complications. So I encourage you to share our post. Anytime you come across our post, let's share it to other platforms and other pages, and let us encourage people. Tonight, I just want to talk about things to consider or things that you need to note after you have tested positive to the hepatitis B virus. Hepatitis is an inflammation of the liver, and there are several causes of hepatitis. We have the viral hepatitis, that is the A, B, C, D, and E. We have alcohol-induced hepatitis. We have chemical-induced hepatitis. We have autoimmune hepatitis. But we place more emphasis on the viral hepatitis, specifically with the B and C, because those are the commonest one, and more people are living with hepatitis B. I wish to let you know that hepatitis B is more contagious, 100 times more contagious than HIV. But it doesn't mean that it is as dangerous or more dangerous than it. As I've always been saying, these diseases are two different conditions that there's no need comparing them, because you can have hepatitis B for several years and not even required to take any medication. But once you are diagnosed with HIV, then what it means is that you are going to take a daily drug just so you could suppress the virus. Let me be quick to add that when you're hepatitis B positive, it is also prudent that you also do what we call the HIV test, because having a co-infection or having those two infections could increase the risk of liver damage. So tonight, what to consider, just as the video is ongoing, you can share and let other people watch. Also, you can, ask your questions, and I'm going to answer them accordingly. You can see I'm looking here, I'm sharing it onto all our platforms, because we believe that more people should get educated. More people should be educated about the condition, and we can help fight the disease. So after testing positive to the hepatitis B virus, one of the things that you must know is that there is a need for you to confirm. Though the initial test probably they did was a surface antigen test, but there is a need for us to confirm, since a lot of the people who come to our churches, who come to our schools, our workplaces and conduct this lab test, we cannot vouch that they are qualified individuals who are supposed to be doing it. So once that happens, then there is a need for us to confirm. And how do we confirm? You can confirm your hepatitis B diagnosis by doing a profile test. When you do a profile test, it can help to confirm. And with a profile test, it's going to outline the various portions of the virus. So after testing positive for hepatitis B, consider confirming your diagnosis. Maybe you went to donate blood and you were confirmed, you were diagnosed. Maybe you went to for a medical examination, or probably you were sick and then you were diagnosed as having the disease. There is the need for us to confirm with a profile test, hepatitis B profile test. And this profile test is going to outline the various parts of the virus. There are two types of the profile test. There is one that just outlines the surface antigen, surface antibody, envelope antigen, envelope antibody, and then the core antibody. And then there is another one that actually quantify the surface antigen, the surface antibody, and that one is actually advanced. And with that, you can do them at the advanced labs like Lancet, MedLab, and the other ones. But the common ones that you can see is just the profile that is telling you as whether the virus is active or not, as whether you have developed, as whether the surface antigen is positive or not, as whether you have a core antibody which shows that there's an ongoing infection or a previous infection. Actually, even when you do the test and it's negative, and you want to know if you have had hepatitis B infection before, a profile test can help you when you do a profile test, it will show that the core antibody is positive, which means that you might have had a previous infection, just that you have recovered. And then after taking the vaccine too, and you want to know if you have developed antibodies, though you need antibody titer test to be able to know the exact amount of antibodies that you have, or to be able to know whether you have developed adequate, antibodies. That one, you need an antibody titer test. But even with just a profile test, it also helps you. So when you are negative and you have taken the vaccine successfully, when you do a profile test, you notice that the surface antibody is going to be positive and the surface antigen will be negative. That is what it means. So after testing positive for hepatitis B, to the hepatitis B virus, consider having a viral load done. And yes, a viral load also done. So with a viral load, it is also going to quantify the amount of the virus per milliliter. So what it means is that some people have done the viral load and we said they were having undetectable level of the virus. What this simply means is that the PCR machine that was used, or the machine that was used to count the amount of virus in your system, could not pick, because it was mostly is less than 20 international units per ml. So the PCR machine couldn't pick the virus because it's very low. Understand that. Let me go back to the profile. Okay, so majority of us who are having chronic infection, when you do a profile test, they tell you the virus is inactive, and you get some medical personnel telling you it's nothing, the virus is inactive, it's nothing, don't worry about it, please. That's not true. That is not true, because you can have an inactive infection and still have a very high viral load. An inactive infection does not mean that the virus is not active. What it means is that there is a minimal multiplication of the virus. It doesn't mean that the virus is just lying dormant. No. It means that though the virus is multiplying, the virus is giving birth in a layman's term, but it is not giving birth more frequently than those who have positive envelope antigen. That is what it means. So, you have to also understand this, that you can have an inactive infection, still have a high viral load, still have abnormal liver function test. New studies even says that you can have an inactive infection, you can even have an undetectable viral load level and still develop liver cancer. Yes, because having an undetectable viral load level does not mean that there hasn't been, or there is no inflammatory process that is ongoing. It is still ongoing, just that there is not going on rapidly. So we need to get this understanding and get to know some of these things so that we can put the right measures in place. So one of the things I said you must consider is a viral load test. Though a viral load test is very expensive, but I think doing a viral load test once every year or twice every year, if you can afford, will be of great help, because the higher the viral load, the higher the inflammatory process. And when you are on any medication, as to whether it's an antiviral or now that people claim to have cure and other things, if you're on any medication, one of the things that will help us to know whether the drug is working well or not is when you have done a viral load. It helps us to know the amount of the virus in the system. And then also, a viral load is important because it also plays a role in determining as to whether you need antiviral drugs like tenofovir, lamivudine, ecantavir, and the rest. So viral loads are very important. When you have also tested positive to the hepatitis B virus, one of the things that you must consider is to do a liver function test. A liver function test basically is talking about how the liver is functioning. And it is helping us to know as to whether more liver enzymes are breaking down, whether more liver cells are breaking down. And this will be manifested in the level of the liver enzymes. So when you do a liver function test, you check that there is something we call ALT, AST, and then we have the gamma, and when these figures are high, it also plays a role in determining as to whether you need treatment or not. So when you have tested positive to the hepatitis B virus, there is a need for you to do a liver function test. At least every 3 months to 6 months, doing a liver function test is important, since that will also help to know if the liver is being damaged. You see, you must understand that the liver can be getting damaged and still functioning very well. The liver can be 80% damaged and still working very well. It is when you have done some of these tests that will help us to pick, some of these abnormalities, and as early as possible, find out what might be causing it. There are people who might have started developing liver cancer, but they are not having any symptoms. But the liver enzymes will be very high, or the liver, function test will be very abnormal, and it will help us. And then the other thing that the liver function test also help helps us to know is the bilirubin level. There are people who complain of having itching, and this itching may be as a result of bilirubin accumulation under the skin. So when you do a liver function test and the bilirubin is high, that would also help us to investigate more and know what is going on. So please, when you do a profile test and a doctor tells you that your virus is inactive, it's nothing, don't worry about it, please. It's not entirely true. There is a need to do some of these tests that I'm mentioning so that it can help you stay healthy. The other one I want to talk about is an abdominal scan. Why an abdominal scan? An abdominal scan because inflammation, when we talk about inflammation, in a layman's term, we say accumulation of fluid in the liver, and this can cause the liver to enlarge. An abdominal scan is important because you may be having an abdominal pain, and it could be as a result of maybe a kidney infection, it could be as a result of a gallbladder stone, there could be other things which is causing this pain. So when you do an abdominal scan, or maybe you have abdominal pain which is as a result of an enlargement of the liver because there is a fibrosis, or the liver is getting fibrosed, or a tumor is developing in the liver, and an abdominal scan will help us pick this thing up and investigate more. When we do an abdominal scan and it shows that there is a growth in the liver, we want to go and take a biopsy and know what is happening there. So it is important that when you are Hep B positive, at least once every 6 months, you want to do an abdominal scan. And the scan that you are doing, please do it at the right place. And let me also add this. I have seen reports, viral load reports, and it's strange. People are, giving figures, because of the money. They take money from clients and then they give them wrong reports. I mean, people will do anything for the love of money. So be careful where you are going to do your lab test. It's very important. The other thing you must also consider is to do an alpha fetoprotein test, AFP, and it also helps to know if you are developing any tumor or there is any cancer that is developing in the liver. And then the other thing you should also consider is changes in your lifestyle. Once you've tested positive to the hepatitis B virus, there is the need, after going through the various labs and any other thing, there is the need for you to consider changing your lifestyle. So if you eat a lot of fat and oil, you want to minimize it. If you are the type that goes in for a lot of sugar and salt, you want to reduce it. You want to do more fruit and vegetables. If you are the type that loves taking medicine anyhow, you want to be careful and know that the medicine you are taking are the ones that have been prescribed by a doctor. If you are the type that drinks alcohol, you want to minimize or avoid alcohol completely. If you are the type that eats very late, for you not to put on weight and build fat in your liver, you want to eat as early as possible. If you are the type that do not exercise, you want to start engaging in some form of exercise so that you don't put on too much weight. When you have tested positive to the hepatitis B virus, you just want to be very careful. You want to consider protecting your loved ones by also getting them tested and vaccinated. And you also want to make sure that you know your sexual partner status, since having a reinfection with an active virus could be quite dangerous. Let's know and understand that the hepatitis B virus also has genotype. There are several genotypes. I may be having genotype 1, you may have genotype 2. So when there is a reinfection, you will be infected with the genotype 2 together with the one that you have. So it is important that you know the status of your partner and put in the right things, and that will be very helpful. Someone is asking a question that what are the signs and symptoms of hepatitis B? Okay, so let me say that about 80% of the people who are infected with the virus do not exhibit any signs and symptoms. And individuals who even have acute infection may not also have any signs and symptoms, so the disease may even go away from 3 to 6 months without them even knowing that they have ever been infected with the hepatitis B virus. But after 6 months and the infection doesn't go away, then we say that you are having a chronic infection. And to have a chronic infection is dependent on the age that you got infected. About 95% of the people who got infected with the virus less than 5 years will grow to have a chronic infection. That means they will live with the disease for the rest of their life. Less than 5% of these individuals, may survive it and may clear the virus. When you are an adult, about 5 years, and you get infected, studies have shown that about 95% of the people may clear the virus even without knowing they have the disease. That is why globally we say 2 billion people have been infected with the virus, but currently we have about 400 million who are living with chronic infection. So people may have the disease for years and may not have any signs and symptoms. And if signs and symptoms may even happen, they are just like having a malaria, having typhoid, having the flu. You have body weakness, joint pains, easy fatigability, in severe cases, you may have yellowish eye, you may have Coca-Cola urine, you may have clay stools, you have abdominal pains, especially at the right side, the upper quadrant, and then you may experience indigestion at some point in time. I know people who are Hep B positive who have complained a lot about insomnia, that is difficulty in sleeping. But basically, the symptoms and the signs of hepatitis B is a fatigability, that is, you get tired more easily, itching, you itch a lot, and this itching is quite persistent and severe. And then people may lose weight, especially when complications like liver cancer might have set in. But those are extreme cases. But in general, the signs and symptoms of hepatitis B: yellowish eye, abdominal pains, easy fatigability, joint pains, weakness. People have nausea. Some may even vomit. In few cases, you may get people having fever and others, but even those ones, they don't usually, exist. So this evening, someone is also asking for my personal contact: 0246 31 0663. 0246 31 0663, and we are always here to help you. Let me end by saying that once you have tested positive for the hepatitis B virus, it is not automatic that we need to put you on treatment, especially with the tenofovir, the antiviral drugs. But now we have good liver supplements like Li52HB. Okay, so as an organization, we talk a lot about Li52HB because it's a drug that we have seen to be very helpful. It has helped a lot of people. Li52HB is a very good drug. So, it protects the liver, suppresses the virus, helps the liver to function well, normalizes the liver enzymes, and reduces the inflammation and the rest. So it's very important. Doctor, what could be the cause of abdominal pain under the ribs? Which side of the ribs, left or right? If it's on the right, it could be that the liver is enlarged and is pressing on your diaphragm. The liver could be enlarged and is pressing on the diaphragm. So, it's pressing on other organs, which is also pushing the diaphragm up towards, against your ribs. So just do an abdominal scan. Let's really know what is happening there. It's not every abdominal pain, that is associated with hepatitis B. So please, let's know this. So as I was saying, once you're Hep B positive, don't go about chasing for drugs and other things. Do your labs. Let us know what is happening there, and then we can make recommendation very soon. Watch out, we'll be in your area. We've resumed our free screening program. So if you're a church, you're a school, an organization, and you want us to come, you can just get in touch with us and we'll be ready to help you. As I always say, testing positive to the hepatitis B virus is not a death sentence. What is the meaning of inactive viral infection? The inactive viral infection means that there is minimal viral multiplication. When you have an acute infection, mostly one of the things that shows a person has an acute infection is the virus is very active. And when viruses, they go through normal disease process. So when you are going through the normal disease process, the virus may at a point get inactive. I'll make a post on the stages that the virus goes through. And at the latter stage, I think on the third stage or so, that they tell you that the virus gets inactive because the body is already controlling it. So this evening, let's end it here, and I believe you are doing quite well. So stay blessed, and we are always here to help. Share the video, let other people also watch, educate someone to get vaccinated for the hepatitis B virus. Thank you. The best liver supplement as of now is Li52HB. Yes, it's Li52HB, and unfortunately it's only available in India. Himalaya, they have their over 100 products on the market, but Li52HB is only available in India. But we have it in stock, so you can just get in touch with us. 0246 63 06 0246 31 0663. Please, can it be affect your sexual satisfaction in bed? No, hepatitis B is not linked to, unless maybe you are developing liver cirrhosis. Then that one, it can affect your erection, and also may decrease the libido of a woman. But someone is asking that after vaccination, is it possible to be infected with Hep B? Yes, it's very possible. Mostly, a lot of the time, what it means is that you had the infection before you were vaccinated. Though we have people who are non-vaccine respondent. We have people that will not respond to the virus. But you see, the truth of the matter is that a lot of the people who go around testing individuals and vaccinating them are not qualified. They are not medical laboratory, scientists. They are just people, and they don't take their time. And that's why I always say that using just a rapid response test kit is not enough to diagnose someone. I have been to screening programs, and after we have disposed the strips. Later I noticed it was positive but very faint, and it will take an expert to know that this is positive. So my dear, it's possible, Cynthia, it's possible that you were positive but they did not diagnose you. But the truth is, you can't take the vaccine, and if the vaccine works, you will be positive. No, you had an infection even before. So one of the things that will help you is that you do a profile test, and it will tell you it's a chronic infection, meaning you've had the disease for a longer period. So let's end it here. Duty calls. I have some projects to defend tomorrow. So I wish you well. Enjoy your evening.